Okay, so if you have peripheral artery disease, or PAD, you already know that nighttime can be, well, the absolute worst. The pain, that awful cramping, it just leads to sleepless nights. So in this explainer, we're going to dive in and figure out the best sleeping positions to finally get some real relief.
It's just such a frustrating cycle, isn't it? You're exhausted, your body is begging for rest and a chance to repair itself, but the second you lie down, bam, the symptoms kick into high gear. That aching, the burning, and that really severe rest pain that can just jolt you awake. It's like it's all waiting for you to get into bed.
Now, you've probably heard this a million times, right? Just prop your legs up on a pillow. I mean, it's the classic go-to advice for any kind of leg pain. But here's the thing. What if I told you that for PAD, that very well-intentioned advice might actually be making everything worse? It could be the one thing standing between you and a peaceful night's sleep.
Okay, section 1, the nightly pain problem. So let's get right into it. Why does it feel like your PAD symptoms have this personal vendetta against you the second your head hits the pillow? What is actually going on inside your body that's triggering all this pain? Well, think about it like this. During the day, whenever you're walking around, your leg muscles are basically acting like a second heart, right? They're squeezing and pumping, helping to push blood through your arteries. But at night, everything just slows down. Your heart rate drops, your blood pressure goes down, and those helpful muscle pumps, they have officially clocked out for the night. And that creates this perfect storm. It's suddenly way harder for your heart to push that oxygen-rich blood through those already narrowed arteries, those little highways, all the way down to your feet. And that lack of oxygen, that starvation, that's what's causing that intense pain.
And this brings us right back to that classic piece of advice, the one you hear for pretty much any kind of leg pain or swelling. You see it everywhere, you hear it from everyone, the idea that propping up your legs is the key to better circulation. I mean, it sounds totally logical, doesn't it?
Section 2, the elevation paradox. Okay, but here's the twist. Here's where everything we thought we knew gets turned on its head. That advice, it's great for some things, for sure. But for arterial disease, it's based on a huge misunderstanding. This is what we're calling the elevation paradox. See, it all boils down to one super important difference, the one between your arteries and your veins. The best way to get this is to picture your circulatory system as having two totally different sets of plumbing. You've got the arteries, they're the high-pressure pipes, forcefully pushing blood out and away from the heart. Then you've got the veins, they're the low-pressure drains bringing all that blood back home. They have completely opposite jobs, and that is the whole key. And this right here is the big aha moment. So if you've got vein issues like varicose veins or just some swelling, elevating your legs is fantastic. Why? Because you're using gravity to help drain the blood back to your heart through those low-pressure veins. Easy peasy. But with PAD, remember, the problem isn't in the drains. It's in the high-pressure delivery pipes, the arteries. So when you elevate your legs, what are you doing? You're making your heart fight against gravity, trying to pump blood uphill through pipes that are already clogged and narrow. So the bottom line is, instead of helping, propping up your legs can literally starve your feet of the oxygen they're crying out for. It just makes that awful ischemic rest pain even worse. You're basically taking an already tough job for your heart and making it almost impossible. Section 3. Best positions for relief. Okay, so now that we get what's really going on, what should we be doing? Let's look at the actual best and worst positions for sleeping with PAD. The goal here is simple. Work with gravity, not against it.
All right, for just general PD discomfort, the main thing is to keep your legs at or below the level of your heart. Sleeping on your back is a great choice, especially if you slightly raise your head and upper body a bit. That creates a nice, gentle downward slope for blood flow. Left side sleeping is also a winner, particularly if you deal with sleep apnea, which a lot of people with PAD do. Just remember to stick a pillow between your knees to keep your spine happy. Now, the one position you've got to avoid, stomach sleeping. Just don't do it. It twists your spine and can make blood flow even worse.
So that's for general discomfort. But what about those really bad nights? What do you do when you're woken up by that intense, sharp pain from severe ischemia, when just lying flat isn't cutting it? Well, what's really fascinating is that clinical studies have shown people in this kind of severe pain often figure out the solution all on their own, just by instinct. It's called the dependent position. And what is it? It's simply dangling the painful leg off the side of the bed. And this is where that whole gravity principle really clicks. It might look and feel a little strange, but what you're doing is using gravity to its absolute fullest potential. You're helping pull that much-needed blood down into the parts of your foot that are suffering the most. And it's not just a theory. Studies that actually measure blood flow in the skin have proven that this can give you a significant boost and some much-needed temporary relief.
Section 4, your sleep success toolkit. Okay, so getting your sleeping position right is a massive piece of the puzzle, but it's not the only piece. Let's talk about some other simple habits you can add to your routine to help your circulation all night long. Think of this as your pre-sleep checklist for success. First, warmth is your best friend. It helps open up your blood vessels, so a pair of cozy, non-tight socks can work wonders. On the other hand, things like nicotine and caffeine do the exact opposite. They squeeze your arteries shut, so it's a really good idea to cut those out late in the day. And hey, even doing a few gentle leg stretches or ankle circles right before you hop into bed can give your circulation one last little helpful nudge. And here's a tip you might not expect. Take a look at your thermostat. I know it feels great to have a warm, cozy bedroom, but research actually shows that a cooler room, somewhere between 60 and 67 degrees, is way better for encouraging circulation and can help prevent some of that swelling that makes things so uncomfortable.
Section 5. When to see a doctor. Okay, and finally, this is without a doubt the most important part. We absolutely have to talk about the signs that mean this is more than just a bad night's sleep. These are the red flags that mean your pad could be getting worse and you need to call your doctor, like, right away. Please, listen carefully and do not ignore these signs. If you have constant, severe pain that just doesn't go away no matter what position you're in, if you notice your feet looking pale or bluish, or they feel cold to the touch, if you have sores on your legs or feet that just aren't healing, these are all signs that things are getting serious. And if you ever experience a sudden, severe leg pain and the leg feels cold, that is a medical emergency. You need to get help immediately. Getting treatment early can make a world of difference.
So it really all comes down to this one question. Is your sleep position helping or is it hurting your arteries? The biggest takeaway here is to challenge that old conventional wisdom. Sleeping when you have PAD isn't just about getting comfortable, it's about basic physics. And once you understand how to make gravity your ally instead of your enemy, you can transform your sleeping position from a source of pain into a powerful tool for getting